अस्सलाम वालेकुम रहमतुल्लाहि व बरकातुहू। मैं हूं आपकी मेजबान नौशीन बेग, और जैसा कि मैंने आपसे प्रॉमिस किया था, पोस्ट भी किया था कि हम आज जो है अपने गेस्ट जो लेकर आएंगे जो इतना स्ट्रेस चल रहा था हमारी कम्युनिटी में इलेक्शन का, और उसके बाद थोड़ा सा रिलैक्स होने के लिए संडे के लिए स्पेशल हमारे जो गेस्ट हमारे साथ शामिल हुई हैं वो हैं डॉक्टर अस्मा चौधरी। लेट्स वेलकम टुगेदर Dr. Asmaa Chaudhry. And before that, I would like to introduce her that she is award-winning board-certified dermatologist in Northern Virginia. She offers medical, surgical, cosmetic, pediatric dermatology. Welcome, Dr. Asma. Assalamu alaikum. How are you?
Assalamu alaikum, Nausheen. Alhamdulillah, it's so nice to be here with you. And आपने शुरू किया था उर्दू में, और मैं पूरी कोशिश करूंगी कि जितना भी मुझसे उर्दू में किया गया मैं आपके साथ जरूर करूंगी, और के जो अल्फाज मुझे मुश्किल लगेंगे then I will transfer over to English. But it's so nice to be here. Thanks for having me.
You're welcome. My pleasure. And also look at this कि जो भी हमारे गेस्ट हैं वो लोग वो बायलिंगुअल हैं, यहीं पे रेज हुए हैं। जैसे इससे पहले जो है अनीला रहमान हमारे साथ एज अ गेस्ट आई थी, और शी बोर्न एंड रेज हियर टू, एंड लुक्स लाइक डॉक्टर अस्मा same to you as well, I think, right? And look at your Urdu, आप बोल सकती हैं माशाल्लाह, communicate.
Yes, so I think it depends a lot about the what was stressed in the house, and so we were stressed and we were encouraged to speak Urdu, and so इसलिए मुझे उर्दू भी आती है, पंजाबी में भी बात कर लेती हूँ, और इस वजह से जो मरीज हैं उनके साथ कनेक्शन थोड़ा सा और पर्सनल हो जाता है, लेकिन अल्लाह का शुक्र है, yes, it's very important to teach our children.
Yeah, alhamdulillah. And before we start different questions with you, Asma, ये बताइए कि आपने ये जो डर्मेटोलॉजिस्ट है, अगर कोई बनना चाहे, कोई हमारे साथ, जैसे अभी हमारे गेस्ट हैं, ऑडियंस हमारे साथ में है, हमारे फ्रेंड्स, तो वो पूछना चाहते हैं कि उनको क्या करना होगा डर्मेटोलॉजिस्ट की एजुकेशन के लिए?
This is a very good question, और ये एक मेडिसिन की ब्रांच है। डर्मेटोलॉजिस्ट बनने के लिए मेडिकल एजुकेशन मुकम्मल करना पड़ता है। पाकिस्तान में और अमेरिका में बहुत ज़्यादा डिफरेंसेस हैं, लेकिन एसेंशियली मेडिकल स्कूल की ट्रेनिंग के बाद, तो पाकिस्तान में तो ज़रा जल्दी शुरू हो जाती है, अमेरिका में कॉलेज के 4 साल करने के बाद एंट्रेंस एग्ज़ाम होता है, उसका नाम है MCAT। वो उसके बाद अगर दाखला मिल जाए 4 साल मेडिकल स्कूल के बाद, उसके फिर स्पेशलाइजेशन शुरू हो जाती है। डर्मेटोलॉजी में अप्लाई करके डर्मेटोलॉजी की जो स्पेशलिटी है ना, वो कम से कम मेडिकल स्कूल के बाद 4 साल एडिशनल ट्रेनिंग की है। तो इफ यू काउंट मेडिकल स्कूल, कॉलेज, रेजिडेंसी, this is about 12 years of training after high school.
Good to know. और अगर आप सोचते हैं कि आपके बच्चों का कोई इंटरेस्ट है इसमें, तो प्लीज उनको encourage करें, because we are looking more doctors in this field, just Dr. Asma.
Yeah, that's very nice. Yes, and there is a shortage of dermatologists. If anybody's out there who wants to be a dermatologist, I really strongly encourage them to do that. There are fewer dermatologists being trained, not enough to meet the demand of the growing population. And so, we have a lot of non-dermatologists offering skincare advice, but really the expertise is with the board certified dermatologist. So I encourage anybody who's interested to reach out to me, talk to me, and forge ahead.
Perfect. Thank you for sharing this, Dr. Asma. अच्छा, आजकल जो है आप बताइए कि क्या अपडेट टेक्नोलॉजीज हैं, लेकिन बिफोर दैट I want to tell you that we have Saima Niaz. Thank you, Saima, for joining us, and she's asking you that how to maintain pores.
Oh, I get asked this question a lot, and the vast majority of patients want a quick, easy fix to their pore size. And I'm here to give you bad news. I'm here to tell you that the pores that you have are genetic, and no matter which product promises to reduce your pores, that's really not very possible with over-the-counter products or even topical creams. You may have some benefit from retinoid creams, prescription strength long-term, but the reality is pore size, in addition to under eye dark circles, are one of the most requested things that people ask me about. And this is just one of those things that's incredibly difficult to change. Your genes are your genes. And as the same way that it's not possible for us to change the number of hair follicles that you're born with, it's not possible for us to change the size of your pores. Now, this is not 100% a hard and fast rule. You know, there are some ablative lasers and other technologies out there. We use microneedling to help reduce the appearance of pores. We use ablative lasers like CO2 lasers or fractionated lasers to help reduce the appearance of pores. But it really depends on your skin type, your age, what kind of a difference you're looking to make. And so this is done on a case-by-case basis. But what I can tell you is all of these products that are out there available on the market over the counter that promise to decrease your pore size, they're not really decreasing your pore size.
Great, perfect. I hope साइमा ने आज जो है वो सुन रही होंगी अपने जो उन्होंने क्वेश्चन किया था. अच्छा, इसके साथ ही रिलेटेड एक और क्वेश्चन जो है अस्मा बहुत ज्यादा पूछा जाता है एक्ने के बारे में कि जैसे एडल्ट यूथ जो होते हैं उनको बहुत ज्यादा इश्यूज होते हैं एक्ने का. तो उस बारे में आप क्या बताती हैं?
So acne is a very common thing that we treat. It's our bread and butter. तो इसकी कोई subtleties हैं जो बहुत जरूरी हैं और tease out करनी पड़ेंगी. Acne is treated by the type of acne that we see. So, you know, we categorize acne into several different categories. उसमें age-related भी changes होती हैं. So, for example, when I am evaluating an acne patient, I'm looking at the subtype of their acne and the severity, and that's how I come up with which treatments are going to work the best for them. So the broad ways that I categorize acne are in an inflammatory category, which includes those deep pimples and the red bumps and the pus bumps. And then in non-inflammatory acne, which includes non-inflammatory lesions like blackheads or whiteheads or jo clogged pores hoti hain. And then I look at other categories like adult female hormonal acne. So there are distinct categories, and it's important to differentiate which category of acne you have, because that's how we determine the treatment. So, you know, एक common misconception ये है कि जो acne है ये बचपन में होती है या adolescence में होती है, teenage years में होती है, ऐसा कुछ नहीं है. Acne can occur from birth to death, and there are different variations with it, of it along with different age groups. And so it's important to know which type of acne, the severity of it, the distribution of it. There are some people who have very limited acne, and then there are people who have it on their chest and back and on other parts of their trunk. So, you know, acne treatments vary based on age, severity, distribution. So, you know, we use so many different techniques. One technique, you know, for the milder forms of just clogged pore acne, you know, we use topical creams, retinols and retinoids, and then we use specialized face washes, whether or not they contain benzoyl peroxide or salicylic acid. And as we go up the severity ladder, जैसे acne ज़्यादा severe होती जाती है, हमारा approach और ज़्यादा extensive होता है. So there are some people who have terrible acne that is scarring and can leave permanent marks on their face. तो उन लोगों के लिए हमें ज़्यादा aggressive approach करना पड़ता है. Sometimes it includes oral medications. There are some other cosmetic treatments that we can do. You know, for mild acne, we do things again like hydrofacial or microneedling or chemical peels. So it's very variable. And the short answer is it depends on the severity and the age and the distribution.
Great, great. I heard those, I know that it wasn't common before, but अब आपने देखा होगा कि ये सारे treatment जो हैं, हमारी जो community है, वो जो है, उसमें इसको adapt कर रहे हैं.
Bilkul, absolutely. And we are a community with very specific skincare needs. You know, we have very different variations in our skin texture and tone and pigment, and we have different needs. And especially one of the biggest issues is the hyperpigmentation, या जो वो दाग पीछे रह जाते हैं, और ये बहुत डिस्ट्रेसिंग होते हैं हमारे लोगों के लिए, and it's a प्रॉब्लम. तो एक्ने को ट्रीट करके भी, सॉल्व करके भी, जो बाकी दाग रह जाते हैं उनकी अलग ट्रीटमेंट्स एड्रेस करनी पड़ती हैं. It's a big part of what we have to do for the patient to feel like their skin is clear. So absolutely, you're right.
वो आपकी एक वीडियो देखी थी आपने, उसमें हाइड्रोफेशियल ट्रीटमेंट दे रही थी, एंड इट लुक्स लाइक वेरी वेरी रिफ्रेशिंग द स्किन आफ्टर दैट ट्रीटमेंट.
It's a wonderful treatment. One of the benefits of that treatment really is, unlike a lot of other skin treatments, this is a treatment that is beneficial and safe for every skin type. So every skin texture, every skin tone, and not only can we extract all the oil and sebum and blackheads that are there, but we can infuse certain serums based on your particular skincare needs to either brighten or hydrate. So it is a wonderful treatment. And, this is something that can be used on a monthly basis, for upkeep. It can be used quarterly, but it is one of the most popular cosmetic treatments that patients come in for. And so instead of the facials that people are used to, I always recommend get a medical grade facial. We can customize it for you. They're more effective, and it's great. Feels great.
Alhamdulillah. Yeah, we should use all those treatments to look good.
Absolutely. Why not?
और लोग समझते हैं कि कुछ लोग जो एक और क्वेश्चन है आसमा कि ये सारे ट्रीटमेंट्स जो हैं फीमेल्स के लिए नहीं है, मेल्स के लिए भी हैं.
बिल्कुल मेल्स के लिए है. In fact, one of the biggest sort of upticks in my patient population is the male patient. और आजकल आप नोट करेंगी, क्योंकि हमारी जो environment है आजकल कोरोना वायरस की वजह से सब Zoom calls पे हैं, मीटिंग्स भी Zoom calls पे हो रही हैं, सब अपना चेहरा देख रहे हैं सारा दिन, magnified हमें नजर आ रहा है. तो इस साल बहुत ज्यादा जो हमारे new patients हैं, they're males, and they come for these. It's important, and we see and hear that it makes a difference. Your appearance is the first thing that people see. It is one of the ways that you are judged with, before you're even, given an opportunity to talk. And so, I think it's absolutely critical for people to look their best, and then they feel their best.
That's true. That's really true. And I encourage our audience to take the advice from Dr. Asmaa about your skin. Take care of yourself. That is very important. कहीं भी जाते हैं आपकी स्किन, आप जो अपना फर्स्ट इम्प्रेशन होता है उसको ऑलवेज जो है आपको खुद भी अच्छा फील होता है और दूसरों को भी अच्छा लगता है. एब्सोल्युटली. अच्छा अस्मा, आप ये बताइए कि आई वाजंट श्योर अबाउट दैट, लेकिन स्किन कैंसर जो है हमारी कम्युनिटी, जैसे आप साउथ एशियन की बात करें या पाकिस्तानी, इंडियन, अपने लोगों की मैं बात कर रही हूँ, उसमें आपको क्या लगता है कि स्क्रीनिंग करवानी चाहिए? व्हाट काइंड ऑफ स्किन कैंसर डू यू सी, एंड व्हाट आर योर recommendations for that?
This is a very good and important question, Nausheen. I specialize in skin cancers, and this is something that I see in my daily career, my daily life, and it is also the most common type of cancer worldwide. So if you yourself personally have not had skin cancer, chances are that somebody that you know has had it. So, our South Asian community is no different. Now, people assume that skin cancer is more prevalent in more fair-skinned individuals or Caucasian individuals, and that is absolutely the case. It is more common. But what is interesting to note is that there are certain types of skin cancers that may disproportionately affect people of color. So Asian, Hispanic, African-American people. And when they are diagnosed with these, they can have a worse outcome. So just to give you, the example in the United States, skin cancer in Caucasians, let's take the deadliest skin cancer, which is melanoma. This is a serious skin cancer, and our best hope in helping patients with this cancer is finding it early. So in the case of the United States, 22 per 100,000 Caucasians will develop melanoma in their lifetime. This is a pretty good number if you consider the hundreds of millions of people that live in this nation. 22 per 100,000 Caucasians will get it. By contrast, 2 out of 100,000 African Americans will get it. But the subtype that they get is deadlier. So if caught early, we can initiate therapies, we can do treatment, and we can, have a cure in 95+% of Caucasian patients. That is not the same of African American patients. Their 5-year survival rate dips to the 60%. So even though skin cancer may be less prevalent in South Asian societies or Hispanic or African American societies, when they do get skin cancer, they get worse outcomes. And this can be due to a variety of reasons. It can be due to social economic status reasons. It can be due to the fact that, the time that it takes to find skin cancers in these patients is sometimes delayed. It can be because, our communities don't emphasize skin cancer screenings like other communities do. Every day I have patients that come in that say, मुझे तो सनस्क्रीन की जरूरत नहीं है, मैं तो घर बैठी रहती हूँ, या मैं तो बहुत ज्यादा फेयर नहीं हूँ, मुझे तो स्किन कैंसर की जरूरत नहीं है. तो जो मिस इन्फॉर्मेशन है ना, वो बहुत ज्यादा प्रेवलेंट है हमारी कम्युनिटी में. So this is why, I really like platforms like this, because we have a deficiency in education in our communities regarding skin disease and skin cancer. And so this is how we bring it up to patients. इसका क्या कर सकते हैं? बस इसका ये कर सकते हैं कि you reach out to your primary doctor, you reach out to a dermatologist, and you get screened for skin cancer. And there are certain things that we look for. Of course, you can't see every square inch of your skin, and that's why dermatologists are here. Lekin, we need all patients to be screened at some point, and perform self-exams to see if they themselves have moles or lesions that they're concerned about.
Wonderful. Those are the ट्रू कॉन्सेप्ट जो मैं भी सुनती हूँ अपनी कम्युनिटी में कि हम लोगों को स्किन कैंसर जो है वो बहुत कम है, लेकिन अच्छा है कि आपने बताया ताकि हम भी जो है इसके स्क्रीनिंग करवा सकें स्किन कैंसर के लिए. और एक और आपका पोस्ट जो है इसी के हवाले से मैंने देखा था, sunscreen, how important it is to use sunscreen.
Absolutely. On daily basis. Yeah. This is the biggest factor that we have in our control to reduce and prevent skin cancers. There's a lot of other factors that are not in our control. And if you take a step back and you look at societies that live close to the equator and, look at South Asia and, other Asian, African societies, a lot of our countries back home are agricultural countries, and women and men spend a lot of time out in the sun, and they don't get this education. And here, the skin cancer that's the most prevalent is a skin cancer called basal cell cancer, and it has very common features, but it can be very different in Caucasian patients versus skin of color. So, for example, basal cell cancer in a predominantly white population tends to be skin colored, tends to be subtle, maybe lesions that can bleed a little bit easier. They're going to occur in areas that patients have the most sun exposure. But if you contrast this with South Asian countries particularly, their basal cell cancers look very, very different. They're what we call predominantly pigmented basal cell cancers, meaning the skin cancers have pigment and they get misdiagnosed, or they get missed because a lot of people think it's a mole and it may look similar to other moles. So not only are the prevalence and subtypes different, they look different. So it's really, really important to know your skin and to reach out to your primary care doctor or to your dermatologist if you think that you have something new or different.
Great, good to know. And another issue that we were talking about, Asma, before the program is hair loss. वैसे तो बहुत ज्यादा नजर आता है, लेकिन आपने 2-3 पिक्चर्स अपने फेसबुक पे शेयर की थी, दैट इज वेरी डिफरेंट हेयर लॉस था, उसके बारे में थोड़ा सा डिटेल बताइए हमारे ऑडियंस को।
Hanji, I'm so glad you asked this too, because this is again one of the most common things that I get asked about. अगर तो आप देखें, hair is such a very, very important part of our well-being and our psyche and how we feel about ourselves. And when you start to lose hair, this not only is a medical issue, but it causes a lot of psychiatric, psychological, and emotional issues as well. And so it's really important to get it treated. So just like we discussed with acne ke multiple reasons hote hain, same exact thing with hair loss. So we treat hair loss. Again, we divide it into the categories, and there are two main categories that we look at. One is non-scarring hair loss, which thankfully is the majority of the different types of hair loss. And then we also have scarring hair loss. Ab scarring ka matlab ye hai ki it is a type of hair loss where your hair follicle undergoes scarring, or what we call fibrosis. तो वो जो बाल झड़ जाते हैं वो वापस नहीं आ सकते. It is a more permanent type of hair loss. तो उसके भी कई मुख्तलिफ causes होती हैं. Autoimmune disease, lupus, certain hairstyles over time. So if you have seen people who use very tight hairstyles over time, initially you will lose hair. And if you stop the tight hairstyles, you have a very high chance that the hair follicles will recover and come back. But prolonged use of tight styles will cause permanent hair loss. So when we talk about scarring alopecia or scarring hair loss, there are several different types of hair loss that fit into that category. Thankfully, the most common types of hair loss are non-scarring, and they can be due to a variety of reasons. Your hair very much so is a reflection of your overall health. So, your hair can give me clues about what's happening inside your body. So pattern dekh ke, onset dekh ke, or factors dekh ke, I can determine, is this, due to thyroid disease? Is this a factor of another chronic condition, or is this an autoimmune condition? Abhi recently मैंने तस्वीर post की थी hair loss की अपने Facebook पे, and this was a patient who had an autoimmune condition that is actually also associated with thyroid disease. So there are a lot of underlying conditions that can cause different types of hair loss, and we have to identify sometimes any other internal problems. So this is why dermatology is such a important part of the medical field, because your skin is your largest organ, your skin, hair, and nails. And what's happening on your skin is sometimes giving me just really specific clues about what's happening with your overall health and what's happening inside your body. तो hair loss की वजह से हम कई लोगों को thyroid disease से करते हैं diagnose, या lupus or other autoimmune disease. So I think one of the biggest things is हमारे जो देसी टोटके होते हैं, ये एक बहुत problematic चीज है.
That's good to know.
बड़ा था कि ये तेल लगाना है और ये कुछ करना है और वो करना है और ये करना है और अंडा लगाना है, दही लगाना है, और हर रोज, I have patients who are actually creating worsening problems क्योंकि हमारे टोटके तो खत्म नहीं होते. So, my advice is, if you truly believe you're experiencing hair loss, you really need to be seen by a professional. और एक और चीज जो मैं जल्दी से बताना चाहूंगी सबको, because I think this is lost in translation, and I don't think that a lot of people are aware that you are supposed to lose 150 to 200 hair every single day. This is normal loss, normal cycling of a healthy head of hair. So, लोग कहते हैं कि मेरे शावर में बड़े बाल झड़ते हैं, या जब मैं कंघी करती हूँ तो इतने बाल झड़ते हैं, मैं चाहती नहीं हूँ कंघी करना, मैं तो डरती हूँ नहाने से. It's really important to know that to maintain a normal scalp, you will have loss every single day. If you continued to lose 150 to 200 hair every day without proper regrowth, hum sare ganje hote. So, I really want people to understand that it is normal to lose a lot of hair. It's normal to see a lot of hair in the shower. Or जिस तरह हम रोज नहीं हर वक्त बाल धोते, हर दूसरे या तीसरे दिन के बाद धोते हैं, उस वक्त लगता है कि ज्यादा बाल झड़ रहे हैं. But remember, every day you're supposed to lose 150.
और इसमें ऐसे ये नहीं है कि आप एक एज के बाद जो है आपको हेयर लॉस होगा. मैंने टीनेजर्स को भी देखी है ये प्रॉब्लम, ये इश्यू.
Absolutely. And when we are getting older, I mean starting in our 30s, we look different than we did in our 20s and in our teens. But the expectation is that our hair will be the same. And that's just not possible. At every decade of your life, there is a qualitative and quantitative reduction in your hair. So, I have women come to me, they're their 50s and their 60s, तो वो तस्वीरें लेके आती हैं अपनी पुरानी, कि बचपन में मेरे ये बाल थे और शादी के वक्त मेरे ये बाल थे. तो मैं उनसे पूछती हूँ कि जब आपकी शादी हुई थी 30 साल पहले, अब आपका चेहरा भी वैसे नहीं लगता, तो आपके बाल कैसे लगेंगे? So as a normal function of aging, we do have to accept that our hair will decline. It's not a nice concept and it gives a lot of people heartburn. लेकिन हमारे बाल एज के साथ साथ कम होते जाते हैं.
अच्छा, आपने अभी ये जो एक्सेप्टेंस की बात की है, स्किन वाइटनिंग का पाकिस्तान में बहुत ज्यादा कॉन्सेप्ट है, उसके बारे में यहाँ पे मैंने ये ट्रीटमेंट्स नहीं देखे या मेरी नजरों से नहीं गुजरा, तो आप इसके बारे में हमारे ऑडियंस को बताइए.
ये जो चीज है ना, ये दिस इज समथिंग वेरी नियर एंड डियर टू माय हार्ट. Because अभी थोड़ी देर पहले मेरे ऑफिस में somebody had a devastating result from bleaching creams, and so I want to speak from personal experience and as a physician. तो अभी थोड़ी देर पहले दिसंबर जनवरी में मैं पाकिस्तान गई थी. तो काफी सालों के बाद गई थी, मेरा ख्याल है 10 सालों के बाद गई थी, अपने बच्चों को लेके गई, and we went to several different cities. तो उधर भी मैं मरीज देखती रही हूँ, कोई छोटे शहर थे वहां भी मैंने मरीज देखे हैं. तो मैं खुद फार्मेसीज में गई हूँ, मैंने कहा मैं जरा पता करूं कि ये जो फार्मेसीज हैं कौन कौन सी ड्रग्स अवेलेबल है, मैं किस तरह ट्रीट कर सकती हूँ इन मरीजों को. तो I was shocked to go to these pharmacies in Pakistan to find medications or skin creams, because there was not a single thing that did not have fair and lovely or fairness. कुछ भी नहीं मिला. और जो बेसिक फेस वॉशेस भी होती हैं उनमें भी हर चीज fair. So the problem here is that we have a society that is obsessed with fairness. And they, for this reason, have bleaching creams in normal household products. So this is actually a medication. It's hydroquinone. तो यहाँ भी मिलती है, यहाँ इतना क्रेज नहीं है. और जो मेजोरिटी यहाँ मिलती हैं वो प्रिस्क्रिप्शन के जरिए मिलती हैं, आम नहीं बाजार में मिलती. जो बाजार में मिलती हैं वो बहुत लो परसेंट होती है. पाकिस्तान, इंडिया, बांग्लादेश, नेपाल, वहां तो बहुत ज्यादा हाई परसेंट वाली भी मिलती हैं और हर जगह मिलती हैं, आसानी से मिल जाती हैं. So the problem is, and हाँ जी,
प्रॉब्लम तो ये है ना कि सबको गोरी चिट्टी बहू चाहिए, तो वो सबको
खुद चाहे गोरी चिट्टी ना हो, उनको बहू गोरी चिट्टी चाहिए होती है. लेकिन the problem is there is a known medical side effect of hydroquinone, even in low percents, that when they have been used for extensive periods of time, you can develop this very ironic and paradoxical skin darkening that becomes permanent. And I don't think people realize this. A lot of those Korean skincare products that people use, unme bhi yahi cheez hoti hai, kyunki everybody says, oh, we use these Korean products, they're so nice. Yeah, they have the bleaching creams, or shuru mein to nice hi lagte hain. But the problem is, with prolonged, sustained use, there is an enzyme in the skin that is affected, and you get these terrible, hyperpigmented, एक किस्म की छाइयां पड़ जाती हैं, लेकिन वो परमानेंट होती हैं और बहुत डार्क होती हैं। उसका नाम है, it has a name. It's called exogenous ochronosis. And this is one of the most heartbreaking things that I see in my clinic. That young girls, 30 years old, 35 years old, have been using this product without any knowledge. These fair and lovely creams, Olivia, Archie, pata nahi kitne kitne naam hai. And they come to me with this terrible side effect that then I have very little recourse for. You know, there are maybe some lasers that might help with 25% improvement, but ye jo chaiyan pad jati hai na inse, ye permanent hoti hai, and it's heartbreaking. So, and a lot of these young women had beautiful skin before they started using it. And so, you know, they bring me pictures कि doctor ये मेरा चेहरा पहले ऐसा था तो अब ऐसे कैसे मैं करूँगी, and it's really heartbreaking to tell these women that, you know, I have very little I can do for them. So again, just like with skin cancer, there really needs to be an informational campaign where we really address this in our people and say stay away from the bleaching creams.
अस्मा, आई थिंक जैसे हमारे अभी ऑडियंस हमारे साथ शामिल हैं, वो भी हो सकता है इंशाल्लाह एग्री करेंगे कि हमें अपने बच्चों को कॉन्फिडेंस देना है कि जैसे अल्लाह ताला ने आपको बनाया है, पैदा किया है जिस स्किन टोन में, वही खूबसूरत है। उनको कॉन्फिडेंस दें ताकि वो आगे बढ़े उसके साथ, ना कि वो किसी चीज में शाये हैं। वो छोटे हैं, मोटे हैं, जो भी है, जो एफर्ट्स हैं आप करें अपने आप को बेहतर बनाने का। लेकिन कुछ चीजें ऐसी होती हैं कि आपको अल्लाह ताला बेहतर जानते हैं कि किस तरीके से आपको बनाना, तो उसको एक्सेप्ट करें और उसके ऊपर खुश हों। होता है ना, हम लोग कंप्लेन इतनी करते हैं कई चीजों पर।
हाँ जी, बिल्कुल। I mean, 100%. This is not new. This is a big epidemic in our people and so many other societies of colorism. And we have to address it at the level of our personal families. You know, and as in a wider society as a whole. Even now, you go to Pakistan and you watch the commercials on TV, and they're not using actors or actresses that are dark skinned. They're preferring people who are light skinned. Everything is fair. Everything is lovely. And so it needs to be addressed on two levels: a societal level, and then, you know, a personal level within our own families. And until that's done, I don't see this changing. And I see a lot of effects. You know, and I really very briefly want to touch on something because it just reminded me of another subset of patients that I see that really is very hurtful to me. And that is when parents bring in young girls or teenage girls and they ask me for things that will help lighten their skin. And often what I'll hear is, ये जब पैदा हुई थी तो बड़ी फेयर थी, बड़ी गोरी थी, और एज के साथ साथ ये डार्क होती जा रही है. And so they express disdain as these girls are getting older. And if a girl is listening to her mom or her dad discuss the fact that this skin color is not desirable, how is she not going to internalize that? So, you know, we also have these so-called doctors out in the community trying to make a big buck and pushing these things for lightening, like glutathione injections and other things that can have very significant harmful effects on internal organs. And they market it as skin whitening creams or skin whitening injections. This is harmful. It's harmful, and the message that it's sending is a really sad message. So, you know, of course, I have these, you know, parents who bring the children in every summer. इसका रंग काला होता जा रहा है, ये डार्क होती जा रही है, ये पहले नहीं थी, ये किस तरह हम ठीक करेंगे, इसकी गर्दन काली होती जा रही है. I mean, it's really shocking how much of this that I see and how little insight that some communities have in the message that they're sending their children.
डॉक्टर अस्मा, अच्छा है आपने ये जो है वो कहते हैं ना कि आंख खोल दी है, क्योंकि मॉर्निंग शोज पाकिस्तान के, मुझे याद है अभी आजकल मैं नहीं देख रही हूँ, लेकिन उसमें जो है स्किन वाइटनिंग का लोगों को इतने ज्यादा उन लोगों ने कोई साइड इफेक्ट्स नहीं बताए थे, लेकिन ये बताया था कि ये इससे जो है आपका रंग गोरा हो सकता है. थैंक यू सो मच फॉर ब्रिंगिंग अप दिस. एंड आई हैव फ्यू क्वेश्चंस. हो सकता है आप स्क्रीन पे देख रही हैं कि प्लीज आस्क डॉक्टर अस्मा द ट्रीटमेंट ऑफ I'm not sure what is it.
From Amara, I think she is asking about psoriasis.
Psoriasis.
And she's asking, what is the treatment of psoriasis and how can we get a cure from it? Assalamu alaikum, Amara. This is a very good question. Psoriasis is one of those skin conditions that is autoimmune and genetic. Genetic does not necessarily mean that your parents had it. Genetic is so much more complicated than we realize. It means that it is coded on your DNA. So somebody from your gene pool could have had it in the past. A distant relative could have had it, or you could have had a random mutation in a chromosome on your DNA that has now causing you to have psoriasis. So psoriasis is a condition, just for the rest of the listeners, where your skin's immune system is defective. Your immune system in the skin is sending signals for certain parts of your skin to grow much, much faster than normal. And so what ends up happening is that you get these thick, scaly, pink, itchy, unsightly patches on the body. The more common areas to get these are really red, bright, thick plaques on the elbows, on the knees. It can occur very commonly on the scalp, inside the ears, in the skin folds of the body. So this can range from very, very mild to extremely severe, where it can cover every square inch of your body. And these patients often have to be hospitalized and managed medically. There's a big range here, for very mild disease to severe disease. So the bad news is, Amara, that we can't change your genes yet. One day in the future, that's going to be on the horizon. We will have treatments at the molecular level that can change your genes or help patch genes that are defective. But at this point, we don't have that. So to answer your question, this is not a curable condition. It is highly treatable. So this is a condition that you live with forever, but we manage it. And we have wonderful treatments now. So over the last decade, our understanding of this condition has skyrocketed. So we manage this condition based on how severe it is, how much of your body is involved, how much it's impacting your life. And so the treatments range from prescription creams to light treatments to injectable medications, oral medications. This is really something that is done with the close supervision of a dermatologist. I advise you to seek out expertise depending on how severe you are. Primary care doctors can screen this and help treat a lot of the mild cases. Yes, we treat it. It's extraordinarily common, but it's not curable. It's treatable.
थैंक यू डॉक्टर अस्मा। अमारा आतिफ जो हैं उन्होंने पाकिस्तान से ज्वाइन किया है। शी इज अ वेरी गुड नात आर्टिस्ट एंड हियर इज अनदर क्वेश्चन फ्रॉम डॉक्टर साइमा नियाज। शी इज अ साइकियाट्रिस्ट। शी हैज अ क्वेश्चन इफ यू कैन आंसर हर।
Yes. Assalamu alaikum, Saima. It's good to see you. What about retinol? Dermatologists recommend this for various purposes. Yes, retinols and retinoids are our workhorse in dermatology. You're right. Retinol is a molecule that is a vitamin A derivative. And the over-the-counter version of this, slightly different than what you can get in a prescription and less strong, is called retinol. And the prescription strength and the stronger version of the molecule is called a retinoid. These are vitamin A derivatives that have very specific function on the stem cells of your skin, whereby they tell your stem cells, they send a signal for more rapid division. And so we use these for a variety of conditions, and they're, like I said, a workhorse. So not only do we use these for acne to help keep our pores open and prevent them from getting clogged, but this is a very big workhorse for anti-aging. And so, you know, in my patients after their 20s and 30s, I routinely put them on prescription strength retinoids. And I have them use a version of this at some point for the rest of their life. We take breaks for patients who are pregnant or nursing, but this is, again, a workhorse. We use it for fine lines and wrinkles. We use it for anti-aging. It can help. It can give modest improvement in discoloration of the skin. You know, we use it for disorders where the skin is growing too quickly, and we sometimes want to slow that down as well. So there's a lot of conditions that we use it for. Probably the most common is anti-aging and acne.
Thank you so much. I hope Dr. Saima is still watching us. I also have another question from Faik Hashmi. I want to ask treatment of freckles on the face.
This is another very common question that we get. And freckles, first of all, we have to make sure that if you have new brown spots on your face or things that you're not sure about, they really need to be evaluated by an expert, because we have a lot of patients who come in thinking that they have freckles and they have something else. Growths on the face that have texture called DPNs, or, you know, early signs of skin cancer. So the true freckles, we treat this in two ways. The first is prevention, 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 and that is daily, year-round, diligent sunscreen. And then the treatment aspect of this is, again, retinoids, like I mentioned before. There are some bleaching creams that you can use under the supervision of a dermatologist. There are chemical peels that we utilize. There are skin brightening creams. You know, often patients and physicians too, now that we are trying to reduce the amount and duration of bleaching creams, there are some natural skin brighteners that are out there that, depending on your skin type and the extent of your condition, we recommend other things like kojic acid or arbutin, so sort of natural products, licorice extract. I will point out that it's really not a good idea. जिस तरह मैंने कहा था, हमारे देसी टोटके बहुत strong होते हैं. You know, I have patients who will start putting lemon on their cheeks, and it's very important to know that this can cause severe photosensitive reactions like a sunburn and can make it worse. So कई लोग हल्दी लगाते हैं और turmeric, कई लोग नींबू लगाते हैं और कई टोटके होते हैं, मुख्तलिफ किस्म के oils होते हैं. These oils can cause photosensitivity and can cause burn-like reactions that can make it 10 times worse. So I would say for the very basic treatment, if what you have truly is freckles, the only way to prevent them from getting worse is daily year-round sunscreen. And I recommend that people use a zinc-based sunscreen on their face every day. And I have some posts on this on my Instagram to explain why I recommend zinc. I do want to mention that a lot of people think you don't need sunscreen if you're not going outside. And truly now, with a lot of people working from home and spending way more time indoors, they're not really applying sunscreen as often or as frequently as I would like. And I will just say that even when you're indoors, you're getting significant UVA rays. Remember, the ultraviolet light that you know, reaches our atmosphere in the earth is UVA and UVB, and UVA is the one that's most responsible for aging and freckles and wrinkling and pigmentary disorders. These go through our windows. So now in the homes, जिनमें, you know, इतनी बड़ी-बड़ी खिड़कियां होती हैं, we think that we are protected inside. We're not protected. You're getting constant secondary exposure that over time adds up. So I really want to stress the importance of using daily sunscreen for that reason and putting it on without fail.
डॉक्टर अस्मा, आप जो है एक बिग सेलिब्रिटी बन गई. आपके लिए बहुत सारे क्वेश्चंस आ रहे हैं. Thank you so much for taking out time today for our audience, mashallah, or volunteer base. I know you are busy and you are spending some time on the, usually you do with your family. So I really appreciate it. You can see here is another question from Samia Heather.
Yes. Samia, it's nice to see your question. is Nevis of Oda, does it have any treatment? And what are your consultation charges for patients without insurance? The first part of your question, Nevis of Oda. This is a type of birthmark that we see very commonly in the Asian population. And it is characterized by a dark bluish birthmark that often appears around the eyes or the cheeks, and it has a bruise-like appearance. This is something that we can see at birth, but sometimes it doesn't become apparent until the teenage years. So a nevus of Oda is a common birthmark that we see in more commonly in Asian and Hispanic skin types. Birthmarks can be very difficult to treat, and particularly around the eyes, but there is a treatment for this that works relatively well. We use lasers, the same types of lasers that we use to remove deep tattoo pigment called Q-switched lasers. We also use these in the treatment of nevus of Oda. So this is something that, again, needs to be managed and supervised by a board-certified dermatologist. Bleaching creams are not recommended in that area, and they don't work. They don't penetrate to the depth of where the pigment is. So really, laser is the most effective treatment we currently have for that.
Great. Yeah, I know someone that use the laser treatment for that. लेकिन ये होता है कि later on I think for time being वो खत्म हो जाता है, लेकिन फिर से दोबारा treatment करवाना पड़ता है, right?
It may actually. This is actually very true because ये जो birthmark है, it's characterized by pigment cells that are very deep under the skin. So if you didn't get all of them, sometimes they can regenerate. So occasionally these patients have a series of treatments that we perform, and then sometimes maintenance treatments every couple of years just to make sure that we're getting pigment that's returning. So it can be an ongoing process.
Great. There is another question Simon as आपसे पूछ रही हैं.
Mesoaesthetic Milan Tranex and retinol. So I don't know what that is. I don't know if this is a brand. If you are asking about Tranexamic Acid, this is one of the topical treatments that we use for melasma. Tranexamic acid topically can be used with retinols, and I do have patients that are on oral tranexamic acid, and these can be used with retinols together. Again, I cannot give any specific advice to patients. All of this depends on your particular skin, and so too much irritation can cause worsening of pigment. So, I'm not going to be able to give any personal advice.
And also she's in UK, so maybe the products may be different names, brands.
I believe that.
Also, here is another, this is the last one, Dr. Asmaa.
Sure.
Do you offer any treatment packages for the underprivileged without insurance?
So this is a very good question, and this is something that's very near and dear to me. And when I go to Pakistan, I definitely spend time doing this and treating the underprivileged. And I just opened a new practice, and it's in its infancy. But one of my goals is to offer a dermatology clinic once a month, free of charge for those who need it. So, follow me on Instagram, on Facebook, and we'll keep you updated when we get that process going.
Awesome. And your office is in Aldi, right?
It's in Aldi, Virginia. Absolutely. It's in Aldi, Virginia, which is in Loudoun County. It's located close to the Ashburn area, South Riding area. We treat patients from all over. I have patients coming from neighboring states and neighboring counties and traveling sometimes 2-3 hours to come see me. So Aldi, Virginia, and Loudoun County, yes.
Great. Thank you so much for all those questions.
It's been such a pleasure.
Spike is asking about if you know about this medicine.
So there are 5 million different over-the-counter creams that claim to be for freckles. And like I said, there are a handful of things that we use. You got to make sure you've got freckles first. And lots of pigmentary creams that say melanin creams are bleaching creams. And we discussed what can happen with unjudicious use of bleaching creams over time. So my suggestion is to make sure you have freckles. if nothing else, use a zinc-based sunscreen on your face, and then reach out to your local dermatologist.
Thank you so much. Thank you for everyone who were with us, our audience, and awesome. I think we have to invite you again, Dr. Asmaa,
This
because
has been a pleasure.
I was going to ask you about the diet too, that what type of food or diet plan should we have that affect on our skin, but I think we should do later on the other program with you, inshallah. And जैसा कि आपको पता है इलेक्शंस की वजह से गहमा गहमी थी यूनाइटेड स्टेट्स में, तो उसी के हवाले से मैं कुछ शामिल करना चाह रही हूँ। बाइडेन के मुताबिक अब वक्त आ गया है कि पूरी दुनिया में अमेरिका की इज्जत और वकार बेहाल होना चाहिए, और कुछ लोग हैं कि वो इसके बारे में बात करते हैं कि पॉलिसीज वही होंगी जो डेमोक्रेटिक या रिपब्लिकन है, कोई भी चेंज। लेकिन मैं ये कहती हूँ कि आप अपनी तरफ से अपनी सोच जो है पॉजिटिव रखें, दोनों जो भी आता है अच्छे की उम्मीद रखें। और इसके साथ ही मैं अपने प्रोग्राम को इख्तिताम करती हूँ। बहुत बहुत शुक्रिया। हमारे प्रोग्राम को प्लीज शेयर कीजिए, कमेंट कीजिए और उसको सब्सक्राइब करना टुनाइट विद नौशीन बेग को मत भूलिएगा। और इसके साथ इजाजत। थैंक यू सो मच डॉक्टर अस्मा। टेक केयर एंड हैव अ ग्रेट वीकेंड।
Thank you. You too. Thank you so much,
everyone.
I look forward to doing this again. It's been wonderful. Thank you.
Inshallah.
All right.